Hi, it's Dr. Dan from PhyxMe Physical Therapy, and I want to speak a little bit today about something called Stockholm Syndrome. And for those of you who've heard about it, you're gonna go, well, where is he going with this? And where I'm going is, when I think about the American healthcare system, what I'm noticing is that many of the patients who come in, especially the ones who think they are educated or informed, are in actuality indoctrinated and blind to what's actually happening, and prisoners of a healthcare system that isn't working for them. And so I'm just going to read something really quickly. What are the stages of Stockholm Syndrome? Cognitive, so that's, obviously it affects our mental. Confusion, delusion, recurring flashbacks, and emotional, so lack of feeling, fear, helplessness, hopelessness, aggression, depression, guilt, dependence on captor, we know what the captor is, and development of post-traumatic stress disorder. As far as the social aspects, anxiety, irritability, cautiousness, and estrangement. And so, and it may seem like a little bit of a stretch, but again, I see patients who have been suffering for years. 3, 4, 5. Actually had one who came in 20 years ago, and he actually woke up because he realized after a brief conversation that what he was doing wasn't working. And so that's where I'm going with this. The medical system says from the outset there is no cure for neuropathy. They can only manage it. And I know this to be true because we had somebody call in the other day, an older fellow, and his daughter, who was a nurse, was in the background telling him, Dad, don't bother, don't make an appointment. There is no cure for neuropathy. So here's a person who's seeking help, and the professional is telling them, give up hope, deal with it. There's nothing you can do. Well, we all know what happens with neuropathy. First you get the shocking sensations at night, or the burning, or the numbness. Then you have difficulty walking, and then there's 3 stages. So first is the nerve damage, then there's the muscle issue, and then autonomic. So it actually starts to affect organ function. That's a big deal. All of those, it can take years for that to develop, but even just the pain is severe. And to be told that you should just deal with it and that that's something that you're going to have to live with is, number one, completely wrong. I know it because in the patient population that I've been lucky enough to work with so far, we've not, and I'm not gonna lie here, we've not had a single one who hasn't responded, not one. And granted, I understand that my streak can't continue, but I'm pretty excited at the fact that we've done so well. We've been doing this for nearly a year now, and across all of the doctors who are using our protocol, there's about 500 of us, the success rate is 97%. And so when people come in and are captive or prisoners in that system, they always say basically the same 3 things. Number one, I'm gonna go talk to my MD about it, which it doesn't make a whole lot of sense to me because that's the same person they've been seeing all along who doesn't have a solution. I actually wrote a blog post about it. You can't rely on a person who doesn't think there's a cure to provide you with a cure. And what is their response going to be when you show up and say, hey, I've got something that is a cure? Well, of course they're going to say no. They're going to poo-poo it and be like, no, it's not going to work. Contrary to what's actually happening, this is working and working very well. That's number one. Number two, they'll say, well, I got to think about it. And that's the cautiousness. You're afraid of making a mistake. Well, you've tried everything else at this point, and it hasn't worked, so there really isn't anything left to lose. The one thing you can be certain of with neuropathy is that if you don't do anything about it, you don't attempt to address it, it will get worse. It's progressive and degenerative in all cases. So it's not a question of if it's going to get worse, it's when and how severe. So that's the second thing that we hear. And then the last one is, well, it's not 100% covered by insurance. Well, insurance is all part of that big merry-go-round system that they keep you trapped in. Of course it's not covered by insurance. It's a cure. It's a fix. It's a solution. It's not subscription-based healthcare. The goal isn't to get you on as many medications as possible and keep you dependent on us. No, the goal is to get you independent and free of us and everybody else. Because there's other changes that happen as well. We get people coming off of blood pressure medication. We get people reducing the amount of insulin that's required, or sometimes eliminating entirely. Because, again, that three-pronged approach, addressing the nerves, addressing the vascular flow, and then, of course, addressing the metabolic component, work. They work. They work to help the body heal itself. I wish I could say there was something that I was doing that was special. It's not it. I'm just providing the roadmap, and then patients follow it, and the body works and does what it's supposed to. So, the question you have to ask yourself is, if you haven't taken action so far, or you're relying on somebody else who doesn't think there's a solution, are you captive to a system that doesn't want you well? Or are you a prisoner of your own making, and a prisoner of your own making? I mean, that's the question. Now, for the people that are tired of suffering, and the people who want to make a change, and the people ready to try something different, that's the old quote, right? What's the definition of insanity? It's doing the same thing over and over and expecting a different result. It's just not how it works. You can't get a different result if you keep doing the same things over and over again. And so we're all about being successful. And for our patients, what that means is getting them out of pain, getting their lives back, reducing or eliminating their dependence on drugs and medication, and helping their body heal themselves. And again, we've had great results with this, and I can't tell you how exciting it is for me every day to come in the office and have people sign up and see them go through the plan and get the great results. I love seeing it. It makes it extremely easy to come into work. It's actually a joy to come into work. I haven't been this fired up, and I've been doing this for 25 years. It's been a long time since I've been this fired up. So if you're ready to make a change, and you don't want to be a prisoner anymore to the neuropathy or that other system, we're here to help. So just give us a call, 773-852-3335, or you can look down below for the email. Just let us know, and I'm happy to, of course, answer any questions as well. There's nothing to hide. There's no secrets. There's no special sauce. It's just work, and you got to do the work. And if you do the work, you get the result. Thanks, and have a great day. I appreciate you listening.